Today on CCHF Talk.
It's very unfortunate that the clients I work with that have larger bodies will purposely avoid going to the doctor because when they walk in, they're told you need to lose weight, when that's not the problem they have.
CCHF Talk is produced by Christian Community Health Fellowship, where healthcare providers, executives, and students come together to educate, encourage, and engage. Join us as we explore topics related to healthcare to marginalized communities. Those talks, those conversations. CCHF Talk.
We're talking today about what would Jesus eat? And I'm going to talk to you guys about Christ-centered intuitive eating, what it is, and how it can actually benefit our patients. And to be honest, I think this might even impact some of your lives personally. I know it did for me, which is what changed my heart. So I am the CEO of Revelation Nutrition. I started this practice back in, I think it was 2019. I am terrible with dates and timelines, but I'm pretty sure it was 2019. I'm a registered dietitian nutritionist, a certified intuitive eating counselor, as well as a certified Revelation Wellness fitness instructor. So my approach to health is a more holistic type of approach. I like to look at the whole person. And I want to give a little bit of background of my story. And this is important because God had to transform my heart in order to impact the clients the way that he uses what I do now. So I studied in Virginia at James Madison University. That's where I got my dietetics degree. I did my internship through Iowa State University as well as the University of Ghana. My background is to work with malnutrition in developing countries. And I had an interest in food when I was in high school. That's where it all started. But it wasn't until I studied dietetics that I actually developed disordered eating. I don't know if anyone who in here has heard of the term orthorexia. Raise your hand so I know. Okay, so a couple of you. It's somewhat of a newer eating disorder term. It's definitely used in the dietetics realm. I don't know how much doctors are using it in practice, but orthorexia is an obsession with healthy eating. So when I studied nutrition, instead of it actually helping me, I became obsessed. And this really spiked unhealthy patterns where I would, instead of having a balance with food, I would just eat really, really rigid, and then in secret, on my own, I would binge out on cookies or whatever foods I deemed as bad, okay? And I ultimately put a lot of my value in my body image, and that's where I found a lot of my identity. So with my own heart issues being off, I started as a clinical dietitian. I also worked in private practice. I had my own business, worked clinical at hospitals, long-term care, and I helped the traditional medical nutrition therapy side of things with my patients. And again, there's a place for M&T. We'll get there. Just bear with me here. But my own struggles with food projected into how I served my patients. So then, back in 2019, when I moved to Montana, so I grew up in Virginia, Fredericksburg, Virginia. I now live in Montana, and it was during that time when God began to show me what was really going on. Food was a form of control for me. It was something that I based identity in with body image and with how healthy I ate. My morality was tied to it. My holiness was tied to it. So really it was an identity issue. And God began to show me that. He began to show me you're tying your identity into your body, into food, and into things that are not of God. So as he began to show me this, I began to really study out biblically. Okay, God, you called me into nutrition. I know nutrition's important. So how am I supposed to take care of my body in a way that honors you, that's not the way the world does it, and how am I supposed to serve my patients? So he began to show me, I began to do research, and he began to show me in the Bible where there's no diet. And I was like, what? There's no exact way of eating? And in school I'm learning, this is what you should or shouldn't do. This is what we do for our patients. And then that's when he showed me intuitive eating, as well as other types of non-diet approaches to nutrition. And so now I use that approach, which we'll be delving into today, in my business with my clients, and it has been transformational for both my life and for my clients. And most importantly, because it gets to the root relationship of food. And I also still continue to do nonprofit work. I work with a couple different nonprofits, but one of the main ones I work with is called El Cuenco, and we are a nonprofit that prevents and treats malnutrition overseas. So I work in South America a lot, as well as we partner with some nonprofits over in Ghana. And so a lot of my personal stuff in my business with my clients also ties into the work that I do overseas. And you will see today in this presentation how the malnutrition that I work with overseas, how in America we actually have a really similar situation going on for different reasons. So my intentions today, I'm going to open a can of worms. You're going to leave with more questions, and that's okay. But I want to help expand our understanding of diet culture, disordered eating, and eating disorders. They're different, and I want to talk about what they are and how they all tie together. I want to talk about how diet culture is harming our patients. I want to talk about how we can identify how our current healthcare system is actually increasing disordered eating and eating disorder risk. We're going to talk about how faith and food are correlated, and we're going to talk about implementing methods of healthcare from a non-diet, non-weight-centric approach. All right, does any of this sound familiar to you guys? BMI and weight being a direct indicator of negative health. Immediately advising weight loss before considering other health and lifestyle factors. Basically not looking at the whole picture of a patient or a patient's health. And often we advise weight loss through things like diet and restriction, exercise, surgeries, and medications. Does any of that look familiar? You guys, I know some, if you're doctors, nurses, some of you study nutrition more than others in school, but this is probably something you've heard with maybe the brief overview you have heard. I heard this stuff too as a dietitian. So what is all of this? What is disordered eating, eating disorders, diet culture? We're going to start with diet culture, and I do want to preface, okay? I am not discrediting nutrition here, and I'm going to focus more on the weight loss side of things. For me, when I had disordered eating, and for others, it's not necessarily to lose weight. Sometimes it's more out of trying to gain muscle. It can be other types of body dysmorphia. But I am going to talk a lot about weight loss today because it tends to be one of the most common things we see in our clinics. But first, let's understand what diet culture is. This definition of diet culture comes from an eating disorder organization from Australia, and it sums up really good all of the different definitions of it. But it says diet culture refers to a set of ever-changing myths about food, bodies, promoting the idea that one's body weight automatically equals health, and that foods can be simplistically categorized as good and bad. It also compromises a moral hierarchy of bodies that preferences the thin ideal while masking a fear of fat. And we see this in our culture, particularly American culture. It's global, but it's particularly American culture. This is driven by our cultural ideals. If you look back historically, body type changes in what was considered acceptable and normal. So it's a very cultural preference. Body objectification, basically saying it's the body that makes us desirable. We put our identity into how our body looks and our appearance. Capitalist industries that gain profit from body dissatisfaction, basically diet programs, weight loss medications. They gain profit because people are not satisfied with their body. Confusion about food and eating. My clients, when they come to me, are so confused because there's so much information out there. What's healthy, what's not healthy. It's overwhelming, it's stressful. It's driven by weight-centric healthcare, so we base patients' health on their weight. Church teaching. Diet culture is in the church, but it's not biblical. That is a whole nother teaching for another day, and it will be mentioned in this today, but it has infiltrated our churches, and it is not of God. And I do believe it's kind of a sneaky way the enemy's gotten in there because it's attacking our identity, which is the root issue here. And also people wanting quick fixes to deeper heart matters. Again, identity, being loved, finding security, finding value in who they are in trauma, and a form of control. A lot of times if we have had our patients or ourselves have experienced trauma, we try to control things, and our body feels like something we can control because we're told by society we can control our body. So disordered eating, on the other hand, the Academy of Nutrition and Dietetics defines it as a range of irregular eating behaviors that may or may not warrant a diagnosis of a specific eating disorder. So you can have disordered eating and not have an eating disorder, but you can't have an eating disorder without having disordered eating. So it's kind of that precursor to an eating disorder. Not everybody ends up with an active eating disorder. These are some patterns, okay? And again, this might be challenging. I experience, and this is just some of them, but when you have disordered eating, you might notice that you find yourself dieting a lot. So yo-yo dieting, following different fad diets. Even the disguised like healthy lifestyle where we eat really clean, like rigid clean eating is a form of disordered eating. And any fear and anxiety around specific foods, trying to lose weight from diets, weight cycling, that's when our weights go up and down. So you might notice patients who, they come in, they have weights go up, they have weights come down, they have weights go, it's constant cycling. Restricting particular meals, fasting for weight and fat loss. skipping meals, cutting out certain foods to make up for what was eaten before, or the, oh, hey, I'm going out to dinner, so I'm going to save up my calories for later. That's disordered eating. Food used for emotional processing, so not having healthy emotional processing strategies. You can't take a day off of exercise, obsession, not knowing how to respect rest and allow your body to recuperate. Feeling out of control when around foods, which is oftentimes patients, you might hear them express, I'm addicted to food. Again, that is a whole nother teaching about food addiction, but I will say that most of the time, 99% of the time, the patient who feels they're addicted to food, they're not actually addicted to the food. It's more so the relationship they have with food that's the problem, and there's many other reasons why they feel out of control around food. Time morality, so I'm really good or I'm really bad, shaming, guilting, excessive thoughts about food and body image, so that constant critiquing. Rigid food rules and schedules. This one is really, we'll talk more about this, but this is really sad to me that this is very common, but people often will change their social situations to accommodate for food choices and vice versa. Overeating and restricting patterns. So this tends, I call it the pendulum. So a person's more likely, like I did, restrict, be very clean and rigid, but then when they're exposed to foods that they deem as bad, they will often overeat those foods. Exercise is a form of punishment or burning off calories. So it's like, oh, I ate that, I need to run more in order to burn off the calories. And also hiding food and eating in secret, which can come from shame or even external sources causing guilt and shame. Eating disorders. In eating disorder, really, honestly, it's very similar to disordered eating. There's just more intense clinical diagnostic criteria, but it's a behavioral condition characterized by abnormal eating behaviors and harmful thoughts and emotions, and it affects us physically, psychologically, and socially. So does disordered eating. It's just a more extreme version of that. And these are the main types of eating disorders we will talk about, or that I'm more so referring to today. Anorexia nervosa, bulimia nervosa, which is incorporates binge eating. Binge eating is a form of overeating, but with bulimia nervosa, your patient will be purging, whether it be through laxatives or excessive exercise, induced vomiting, so they're tied together oftentimes. Avoidant restrictive food intake disorder, so very, very particular about foods eaten. All right, these are just some statistics. I have more, guys, it was really hard to narrow this stuff down, but 9% of our US population will have an eating disorder in their lifetime. That's pretty high, and that's just the US, that's not globally. Fewer than 6% of people with eating disorders are medically diagnosed as underweight, and this one I think is really important for us to notice today. People in larger bodies are at the highest risk of developing eating disorders, and the higher the BMI, which we'll be talking about BMI later, but the higher the risk. And this is very unfortunate. In our medical clinics, we're missing eating disorders and disorder eating because we are weight stigmatizing. In 2020, there were approximately 10,200 deaths attributed to eating disorders. And in a study of teens, dieting was a strong predictor of developing eating disorders. And they were 5 times more likely to develop an eating disorder if they dieted, which is disordered eating, right? It's part of diet culture. And then they were 18 times more likely to develop eating disorders if they practiced extreme versions of restriction compared to those who did not diet. And then 79% of weight loss program participants from a study, and I have a whole list of studies that I can provide for you guys after this. There was a study done that shows 79% of weight loss program participants reported coping with weight stigma by actually eating more food. And this is, the more studies they're doing, they're finding that if people follow diets, they're more likely to overeat food to compensate. So really it's counterproductive anyways, and it increases that disordered eating. So I'm going to show you guys a really important study. This is, I know you guys know how research works. We try to find the studies in the last 5 years, and that's important, but I also want us to not miss the whole picture. And this next study I'm going to show you, you may have heard of it, but it's really important. It was the foundation to discovering the effects of starvation on the body. Has anyone heard of this study, the Ansel Keys study done at Minnesota, University of Minnesota? No? Okay, this was done during World War II. This was so important, this study. They did this to better characterize the physical and mental effects of starvation on healthy men at baseline. The participants were assessed at a normal fed state, and then they were then put into a semi-starvation stage, and then they had a refeeding stage to try and get the men back to their baseline. And then this was done during World War II for the attempt to better support soldiers who were facing starvation during the war. So this study, morally, probably nowadays would not fly, but it was really important during World War II that this was done, and it helps us understand things like malnutrition nowadays to a much better extent. So for 3 months, they received 3,200 calories a day because that was their baseline. These were very active, like healthy men, lots of high muscle mass. They were actually, most of them were part of the Quaker group because they didn't go overseas to fight in the war, so this was their way of serving their country, they felt. So these were very healthy men, had a healthy relationship with food. They were put into a 6-month starvation period. They were given 1,800 calories a day and asked to exercise. And they were expected to lose 2.5 pounds a week to reach the desired 25% weight reduction by the end of that semi-starvation period. Then after that, they were put through a 3-month nutritional rehabilitation period in order to attempt to restore them back to baseline. The results were very interesting, and as you guys will see, very similar to our patients who follow diets. They found, I'm not going to read them all, but lots of changes in mood, a lot more irritability. Their energy levels decreased significantly. They found that they had a decreased tolerance to cold, more dizziness, reduction in coordination, different types of effects in their brain. They had a lot of muscle soreness and muscle weakness, experienced hair loss. I've had lots of clients that have experienced that when following extreme diets. Loss of motivation and concentration, so it was really hard for them to focus on anything they were doing. They would find themselves sneaking food, which is also common with our patients who cut foods out. Increased physical activity to get more food rations. So I don't know if anyone's experienced patients who have like, oh, I exercise. Again, it's that I will exercise more so I can eat more of this. So it's that overcompensation. And they became obsessed with food. They collected cookbooks. They would notice everywhere they went the food. That's all they could focus on. That's all they could think about was food. And then they also had an increase in mental distress, and 2 were actually admitted to the psych ward after discharging from the program. So their mental health declined significantly. Their metabolism decreased significantly as well because muscle mass decreased. Then during the recovery period, I just listed a few of them here that really stood out. They had insatiable hunger. So they would often eat past their fullness level. They didn't know how to listen to hunger and fullness any longer. Their cues were completely distorted. So they basically, one of them even had to get their stomach pumped because they didn't know how to feel their fullness anymore. They had increase in weight gain, particularly their fat stores. So when they did begin gaining weight, it wasn't muscle mass, it was fat storage because their body was thinking, oh, I need to hold on to this energy in case I go into starvation again, and so therefore they increased their adipose stores. Participants were required to have excessive intake of calories in order for their body to rehabilitate. So they actually had to eat more. Their body was so hungry that they overcompensated. They sometimes were up to 4,000 or even more calories a day. Okay, so now let's look at diet culture, dieting, disordered eating. How does it affect our patients? Does any of this look familiar to what we just saw? Okay, and again, the Ansel Keys study was a pivotal study. We have lots of studies now that show these same type of results in our patients who have disordered eating and follow weight loss diets. But muscle pain and weakness, decrease in muscle mass, decrease in metabolism, right? Those are all tied together. A lot of our patients end up with hormone dysregulation. More weight gain over time, again, counterproductive to the diet in the first place. Diets work. You lose weight, but you gain it back over time, plus more usually. Weight cycling, that's where the weight goes up and down. Increase abdominal fat stores, which therefore increases our cardiovascular risk. Decrease in energy, increase in overeating cycles, negative GI symptoms. I can't tell you guys how many patients have thought they have food sensitivities and all these GI issues when actually it's the diet they're on and the stress that's caused by the diet, both from the actual effects of the constant food changing plus the side of the stress that's induced from dieting, and that was the cause of their GI symptoms. As soon as they healed the relationship with food, they stopped having GI symptoms. They no longer had what they thought was IBS, because it wasn't actually IBS in the first place. It was stress-induced. Hair loss and loss of concentration. Diets are not sustainable solutions. They work temporarily for weight loss, but it's not helping our patients in their overall health long-term. 95% of dieters regain their weight loss after 1 to 5 years. Okay, mentally, how does dieting affect us? It increases our food and body obsession. It creates addictive behavior towards food, increases body comparison and dissatisfaction, increases our depression risk, and our risk of suicide, increases feelings of guilt and shame, increases our stress, our isolation. Remember I was talking earlier about how people will change their social situations in order to adapt to what they can and can't eat. It increases negative moods, which therefore negatively impacts relationships. I can tell you for myself, it negatively impacted the relationships in my life. I was the food police. I obsessed about my own food, and I was that person that called everybody else out on their food. I was annoying to be around, I will be honest. Like, I was that person. Everyone hated going out to eat with me. It was obnoxious, to be honest. And for me it was. But God had to heal my heart with it. So it does impact our relationships. And it decreases our ability to be present in the moment. If I'm sitting there eating a meal and all I can think about is my body, what I should or should not be eating, am I good or bad, all the negative emotions, or even the positive, like, oh, I'm good because I ate this. It impacts our ability to connect with the people across the table from us, which is distracting us. And mentally, some statistics, 1 in 4 people with an eating disorder has symptoms of PTSD. So trauma is highly associated with disordered eating. I experienced trauma in my life, and it definitely was my form of control. It was my form of finding value. My body was objectified, and I used my body and what I ate as a form to receive acceptance and value. So deep down, it was a heart issue and trauma that ultimately needed to be healed and dealt with. And the Dove Global Beauty Confidence Report, I really love Dove doing this amazing movement trying to help people find better body image, but they found in their questionnaires that almost 8 in 10 girls, and even more of the women, 85% of women, do not participate in important events in their life when they don't feel they look their best. And this is just women, and I do want to say men very much fall into disordered eating categories. Ultimately for men, sometimes it's the weight loss, but a lot of it is bulk and muscle mass, feeling like what is the American, right? Where like if I stand like this, right? Like, oh, like I'm not a man, guys, sorry, but so I'm not doing justice for you guys. But American society has their own definition of what is considered manly, but again, that's cultural perspective. So men, you're more likely to find them fasting in order to increase muscle. Well, it doesn't actually increase muscle mass over time, but it might make muscle more visible initially, these type of things. So there's still stigma. I just want to say that for men, I work with women mostly, so just so you guys know, that's why it seems very woman-centered, but men are very much affected by this. But yes, and the other statistics, 7 in 10 girls say that they are more likely to be less assertive in their decisions when they're feeling insecure. This really concerns me because this puts men and women, women and men, because if you're not being assertive and you're finding your value in what others think of you, you're more likely to put yourself in vulnerable positions and objectify your body. And this can lead to sex outside of marriage, these type of things, if I'm being honest. Because again, you're putting yourself in a situation, you're less likely to be assertive and feel confident in who you are and not need somebody else to fulfill that desire in your heart. All right, and spiritually, this is where I incorporate Christ into all my teaching. I realize not everybody here necessarily works in Christian clinics, but I do think this is important to understand. We can tie our morality and holiness into what we do and don't eat. This is where we see diet culture in the church a lot. Pastors will, and not just pastors, ministry leaders, all of us, church members, we can be like, oh, I'm following so-and-so diet, so I'm honoring God with my body. We tie our morality into our food choice. It can lead to pride, idolatry, fear, lack of identity, distancing from God through shame and hiding. I have one particular client that really struggled with that one. She would find herself in her car binging, and then she would feel like God hated her, and it would push her away from God. Objectifying the body, again, trying to find our identity in our bodies, which is not why God created our bodies, which is my next point, misunderstanding of the body's role to its entire being, right? Why did God make our physical bodies? What is the purpose? And when we tie it into diet culture in the church, we are misunderstanding the intention of why we have these good bodies that he made. So how are we as healthcare providers, how are we contributing to this disordered eating and eating disorders? And again, I'm making some blanket statements. I realize there can be individual scenarios, but this is mostly what I'm seeing and what studies are showing. But weight bias is altering our standard of care and practice, meaning are we not, or are we offering particular medical testing because based off a person's weight? If a person is in one type of body, do we not forget to completely offer a medical, like, oh, we just need to lose weight, right? Instead of actually doing appropriate testing to figure out what's going on. Using weight as a vital sign when unnecessary for the visit, medical diagnosis, and intervention. Weight is not technically a main vital sign, okay? It doesn't mean we are or aren't healthy. That being said, I understand there are circumstances, weight is important. Look at fluid changes in the body. We want to see if a person has had significant weight loss or weight gain that could indicate hypothyroidism, things like that. So I'm not saying we can just ignore weight completely, but we can't tie that necessarily as a main vital sign to a person's health, okay? And in reality, our patients, unless they want to know their weight, they have a right. We don't need to stress that to the patient every time they come into our offices. Assuming that a disease is caused by weight. This goes back to research. Even in this area of the way I approach, we have to be careful. Association and causation are two different things in studies, right? We're often taking studies and creating causation rather than association. Shaming and shooting the patient about their food choices. Encouraging the restricting of foods and calories in our patients. I, especially as a dietitian, was guilty of that. Okay, we're going to cut 500 calories a day in order to lose weight. Well, at the time, I did not know I was inducing harm on my patient. And as medical providers, we know our goal is not to induce harm to patients. Using BMI as an indicator of health. BMI is my nemesis. Again, I understand there's times and places, particularly in the underweight, but when BMI was implemented, it was done in a particular European region, and it wasn't even put through the proper scientific method process in order to be implemented into our healthcare system. So it's really not an accurate indication of health or a person's, overall wellness, okay? It's just used way too much, to be honest, in our healthcare system. Again, I'm making some general statements, but overall, we want to be careful with BMI. We also want to be careful not to assume that someone does not have an eating disorder or disordered eating because of weight bias. My client wrote this. This is when I actually work with a woman I work with. She said, I went to a new primary care physician last fall, as I had not been to a primary care physician in many years. I asked her to see if we could check my blood work, as I had put on more than normal amount of weight over the last year, and wanted to see if perhaps, given my age, I was perimenopausal, or if there was anything else that could be contributing to the weight gain that I should be aware of. I was so disappointed when she immediately shifted into agreeing that my BMI is too high and that I needed to start counting macros. I asked her to stop there and told her I had a history with disordered eating and counting macros was off the table for me. I tried to clarify that I wasn't asking for help losing weight. I was asking for help understanding what was going on with my body. Her next response was to work out at least 30 minutes a day, increase my protein intake, and if that didn't work, to come back in 3 months and she'd prescribe me a weight loss drug. I was so completely disheartened at her response to my inquiry. Needless to say, I've not gone back. If I wasn't already committed to a path toward intuitive eating, her advice would have led me right back into my disordered eating pattern and into what would have just been another failed diet. This is an actual scenario, and this is one of many that I have come across, okay? And again, I'm not shaming us as medical providers, but I was guilty of assuming these things when I first went into practice as a dietitian. But the weight was not her problem. It was potentially showing that there could be something going on, because for her it was an abnormal amount of weight gain for her specific body. Because weight gain in itself is not a bad thing necessarily, but she noticed something was off. But instead of looking at the root problem, the doctor immediately focused on the weight. Okay? So we have to be very careful of weight bias in our medical system. And just to point something else out here, it's very unfortunate that the clients I work with that have larger bodies will purposely avoid going to the doctor, because when they walk in, they're told you need to lose weight, when that's not the problem they have. And I have, one of my employees has chronic migraines. She stopped going to the doctor for her chronic migraines because all the doctor would ever tell her is to lose weight, and that was not her problem. And so she avoided seeking medical treatment for her migraines because of this weight bias in our society. So this is why I take a Christ-centered approach to health, and I want us to see the bigger picture. When I work with clients, I get to the root relationship with food, because food is not our problem, or weight is not our problem. It's the relationship we have with food. Do some people carry more weight or less weight than their body type needs to have on their body? Yes, but why? It's not because the food they eat or because their body is bad. It's because of the relationship they might have with food. So I look at things like, am I trying to please people with my body or with what I do or don't eat? So I help clients get to the root of that. We look at the root of the fear of rejection, which can stem from trauma. If I've, in my childhood, have been rejected or told by my family members, your body's not good, my relationship with food is going to be disordered. Do I desire to be valued, wanted, and loved through food in my body? Shame and guilting, both external and internal, because we can have these voices in our own head and we can be told by others with the shame and the guilt. Shame on you for eating that. Or you should feel really guilty about your body. Fear of disease, that was a big one for me. I thought I could control and prevent disease. Now, again, I'm not knocking healthy eating. That's a part of what I teach, but it was obsessive. It was unhealthy, and I didn't have a healthy dependence on God with my body. I thought I was in control of it myself. It goes back to control, and that can be for many different factors, many different parts of this, but can I control my body, control what I eat? I'm not going to go down that rabbit hole. Never mind. Idolatry. Do we idolize the body? Do we idolize food? Do we idolize people's opinion of us? Trauma. Again, unhealed trauma. A lot of our patients, if we're just looking at the weight, we're missing it. We're missing the reason that they probably have health conditions in the first place. Trauma is greatly tied to health conditions and developing disease. Inability to process emotions in a healthy way. So our patients might not have tools. Maybe they don't know how to handle stress. Maybe they don't know how to handle when they're sad. Maybe they've never been taught proper emotional support. And also learned behaviors. Was it in their family? Is it something that's familiar to them? So how do we transition to a non-diet approach in healthcare? First, let's define health. The World Health Organization has their definition. It says health is a state of complete physical, mental, and social well-being, and not merely the absence of disease and infirmity. When we look at our patients, we have to remember it's the whole picture, okay? Again, we specialize in things, so sometimes we just look at specific diseases. That's not a bad thing, but we want to remember a person's body. Everything's tied. Our spirit, our physical body, right? Our mental health, they're all tied together. Dieting does not promote the health of a person, and mostly it leads to more harm than good. So what is a non-diet approach? But a non-diet approach, these are some of the ones you'll see. We have the Intuitive Eating by Evelyn Treibel and Elise Resch. They're both registered dietitians. The Ellen Satter, she was also a dietitian. She has the Ellen Satter model. She focuses more on family health and working with kids. Mindful eating practices, and then the Health at Every Size movement. You know, I know there's political stuff out there about it, but I do love a lot of their research around helping to, again, take away weight bias and stigmatization in the healthcare system. But we're going to focus mostly on intuitive eating today, but all of these are ones that I incorporate and use in my practice. I have looked at all of them and asked the Lord to show me which of those things tie in. But these, I do want to stress though, these are our current day models and terminology around them, but ultimately when we get into this, you will see that God created our bodies to eat like this from the beginning. These are just modern terms we put to the way God designed our bodies. Okay, so intuitive eating, I'm going to walk us through the principles. That when I work with clients, I don't necessarily always go in this order. It's a case-by-case situation with my patients. But we look at rejecting the diet mentality. So this is where we come out of agreement with diet culture and we say, okay, my body is good the way God made it. I don't have to fit into the world's stigmatization of what a good body is. And I'm going to choose to walk away from fad diets and take care of my body for my body and what my body was created to be. We look at how to honor hunger and fullness because like we saw back in that Ansel Keys study, as well as the negative effects of dieting on the body, it actually alters our ability to have interoceptive awareness. Do you guys know what that term is? I'm just going to define it. Okay, interoceptive awareness is the ability to listen to internal body cues. So if I have strong interoceptive awareness, I can actually feel my heartbeat without feeling my pulse. If I have strong interoceptive awareness, I can feel what my hunger and my fullness cues feels like in my body. I can feel where stress is held in my body. So it's really a strong innate ability to know what your body is feeling. That is lost with dieting. With weight loss, when we lose weight, all of these things, when we control how much we eat based off of rigid food plans, rather than learning to listen to our body and trust that my body can tell me how much I need. This has to be redeveloped. It is something that takes time with patients, but I work with helping them to redevelop that ability to have interoceptive awareness in the body. Making peace with food. This is taking that morality, good and bad foods, out of the picture, okay? There's room for all foods. Again, we're not knocking health here. We'll get to that. Or when I say health, I mean like fruits and vegetables and grains, right? But we want to take morality away from food. So make peace with all foods. I can eat a brownie and I'm not a terrible person, okay? And my whole health is not going to fall out of the, I'm not going to develop diabetes because I eat a brownie, okay? Understanding the bigger picture. Challenging the food police. So what this is it is all the thoughts that go in our brain, even external voices that tell us, oh, hey, shame on you for eating that, or you should or shouldn't be doing that, or, you know, they told me I couldn't, so now I'm going to rebel and I'm going to eat a whole bunch of this. And these different voices that we fight against in our head, this is one of the things I help clients to identify. What is that voice? Where is it coming from? Is it from God, or is it from diet culture, society, or myself? Finding satisfaction in the food we eat. This is really important, actually, for being able to feel our fullness. If we're not satisfied with what we eat, we will constantly look for that thing to satisfy us, okay? So we see that a lot when we have like low-fat diets. Fat is important in our diet, and fat helps us to feel satiety when we eat. So if I'm on a low-fat diet, I feel like I'm never satisfied. So therefore, I find myself actually eating more than if I just allow fat in my diet. And there's also the aspect of the emotional satisfaction. If I'm in a room with people, if I'm more present in my meal and I'm being mindful, I'm tasting the food, I'm finding gratitude in the food that God made, and it helps me to just be more satisfied overall, which helps heal that relationship with food and body and develop that interoceptive awareness in the body. Learning how to cope with emotions with kindness. So how do we actually work through trauma, stress, emotions without using food? Because emotional eating is another pattern of disordered eating. And so I work with clients. How do I identify what my emotions are? This is where my therapist, I don't know if there's any therapists in here, but therapists are my best friends, and I love you guys. I have my therapist who's actually now one of my best friends, and we do ministry together now at this point because we've worked together for so long. But it's how can we help our patients actually cope through stress, especially if we have patients that work 3 jobs, have no money, and they're struggling. They have stress, you guys. And so what resources can we offer them to help them to work through these things without using food? And respecting our body. Our bodies have a genetic blueprint. You guys know this, right? In medical field, we know that God made our bodies unique and different. So why are we trying to fit them into what is considered a culturally acceptable norm when that's not what God did? He created different bodies diversely and uniquely for good reasons. So it's respecting that my body is not going to be what this person's body is. And how can I take care of my body so I have energy and I feel good, where I make sure I'm eating 3 meals a day if I have access to that food? And how can I buy clothes or wear clothes that fit my body instead of trying to force my body to fit into a pair of pants, right? We can respect our bodies where they're at, even when it comes to incorporating movement and gentle nutrition into our lives. Finding movement that's joyful. When I had you guys move this morning, I know not everybody finds joy in flossing, okay? But my point is, movement is God made us to move and rest, but it doesn't have to be punishment. So find things that bring you joy. Find things that are fun, and it's not supposed to be something, that we have to do to burn the calories, okay? I'm not saying working out at the gym is a bad thing. I'm a fitness instructor. I love teaching fitness classes, but I also dance, and I love that, and that brings me joy. But also respecting where your body's at. You're not a bad exerciser if you can't do 60-pound dumbbells or bench press 200 pounds. That doesn't make you less than, right? Find what works for your body and enjoy that movement. Honoring your health with gentle nutrition. And you can treat our diseases without dieting, you guys. Diabetic diets, right? I understand how diabetes work. I worked in diabetes education. I understand it. I have diabetic clients now. But we don't have to follow extreme diets. We don't need to walk into patient rooms and say you need to cut all your carbs and stop enjoying foods that you like. We can approach this with a more holistic. And again, I don't have time to delve into what that all looks like necessarily right now, but we can still focus on adding in foods that help our bodies to feel good, right? We know that fruits and vegetables and whole grains, if you don't have, celiac or something, but overall, general, right? It makes our body feel good. So how can we help with what our patients' preferences are and with culturally what's appropriate? What do they have access to? What if I have a patient who can't afford ground beef and what they have is beans and they're diabetic? Am I going to tell them that you can't eat beans on your tacos because you're diabetic? No, work with our patients. What do they have available for them and help them to make the best choices for their body with what resources they have rather than shaming and shooting them and telling them they need to now go figure out how to lose weight. We're creating more problems for our patients when we do that. This is how our patients benefit, pretty much the opposite of all the harms, right? We see a decrease in stress and improvement in stress management skills. We see a decrease in GI distress, increased body positivity and self-talk, increases our interoception of the body, improves our lifestyle habits. We see a decrease in things like our overall lifestyle habit factors of lower smoking, drinking, increase in movement, increased consistent intake of fruits and vegetables. Most of my clients, because they followed such diets, they didn't even like fruits and vegetables because they thought they had to eat them in certain ways. So they just didn't eat them. Well, wouldn't I rather a patient have sauteed vegetables than none because they believed that eating them sauteed was bad, where they had to eat them raw, right? I would rather see my patients find fun ways to incorporate these things into their diets. Increases weight stability. So there are lots of studies done that show that weight stability, no matter where the weight is at, is more beneficial to the person's health than the constant weight fluctuation. So when we heal our relationship with food, our body finds the set point weight where it fits best for your body with where your body is at, and that can change a little over time, but we see less of the constant cycling, and that is more beneficial for our patients' health overall. It improves their mental health because they're actually more likely eating enough food to fuel their brain. That was a big thing for me. I was constantly exhausted, you guys, when I obsessed with healthy eating. And you would think that with me eating tons of fruits and vegetables, I would feel great. I didn't, because I wasn't actually getting enough calories overall, and I was not honoring my body and what it needed, and I was pushing it really hard in the gym and all the things to try and achieve this American idea. And my mental health, I was exhausted all the time. I depended on lots of caffeine to keep me awake. Now I technically don't even need caffeine during the day, and I'm wired, and if I drink coffee, you guys would see sweat stains down my pits right now because I have really high caffeine sensitivity nowadays because I don't require it anymore because I have the energy from the food that I eat. And then for believers and even for unbelievers, we can help them and be a light for those who don't know the Lord. We can develop a stronger relationship with Christ because we can't know our identity unless we understand God's heart and character. If I don't understand who God is and I don't have a personal relationship, I won't know who I am, and I will constantly seek my identity in the world. So when we develop that strong relationship with Christ, we have our stronger identity developed, which therefore we stop depending on food and body to establish that. And again, I have a whole list of studies for you guys if you would like them. We're going to go to what Jesus would eat. So what would he eat? If you look through the Bible, did he have a diet that he followed? Was he on a keto or intermittent fasting or low carb? No. Jesus did not eat to live a long life. I'm not saying it's wrong to live a long life, right? But his focus was not to try and control his lifespan. He ate to fulfill his purpose. He met those physical needs. He rested. He spent time with the Lord to find his identity. Jesus never faltered in his identity. He ate food. He broke bread with others, right? He fasted for spiritual purposes. It wasn't a diet for him, and it's not supposed to be a diet. Our culture has taken something God made good and twisted it, distorted it, to where now the focus is on external self, okay? And this is in the church. This one in particular is really common in the church. He did it to connect with his Abba. Jesus' ministry, if we look in the Bible, we see even culturally in the Jewish culture, it was around the table. He broke bread with people. He partook in Jewish festivals. Look at the Last Supper as we are in Lenten season right now, right? He didn't say, oh, I'm on low carb. I can't break that bread with you guys. Like, sorry. I mean, come on, that's significant. Like the blood and the body of Christ. Like he says, I am the bread of life. Like that was so important to him, to meet with people at the table. And what if instead at church meetings or in the doctor's offices, what if we sat down across the table and we connected with the person instead of worrying about, are they looking at what I'm eating? What does my body look like right now? Oh my gosh, I shouldn't be eating that. The enemy is creeping in and he is distracting us from being effective in our ministries by using diet culture in both healthcare and the church. And as Christ-centered healthcare providers, I think this is so important to see. And again, I'm opening a can of worms, but I encourage you guys, dig this out, look into this, and really ask the Holy Spirit to highlight to you where in your personal life is it affecting you, and then how, from your heart transformation, can we more positively impact our patients. Nowhere in the Bible, I've looked, Trust me, I looked. Does God talk about a good and bad body weight? Who defined what that was? When God, I think about this, when God looked at the dust and said, okay, I'm gonna make man in my image. Did he look at it and go, okay, Adam, or you got six-pack abs, yeah, you got them defined calves, okay, we good, now we're good. No. He made Adam, and he said it was good. And he made everybody else after that. He said it was good. Okay? Our bodies are good. And there's a really good scripture I did not put up on the slide, and I should have, but it's in Isaiah, and it says, I'm not going to quote it directly, but it says, like, as the clay, who are we to look to the potter and want to change what he made? That's based in pride. It says that our idea, our image of what is good is better than what God said was good. We do not live on bread alone. If that's what we're obsessing with, we're missing the point, because we live in Christ. And that's how Jesus, firm in his identity in Matthew 4, was able to say to Satan, get away from me, Satan, man does not live on bread alone. He was quoting Deuteronomy 8, 1-3, where God talks about the importance of keeping God as our life source. Ecclesiastes 9:7 points out how food is meant to be joyous. We're supposed to find joy and gratitude in what we eat. And again, if we're just constantly obsessing about it, we're missing the point. Like, God made these things good, even homemade muffins, homemade brownies, chips that are crunchy, and like we can be grateful, we can find satisfaction in these things without overdoing that when our relationship with food is healthy. And ultimately that comes from a healthy identity, healthy heart. We have permission to eat all foods. I mean, I know Jewish regulations had the reasons behind their Jewish practices of why in the Old Testament law, but in the sense of God making all foods good, all foods clean, we have to remember that there is a time and place to enjoy these things in moderation. These are some practical steps as healthcare providers that you can put. You might want to just take a picture of, that's a lot of words. I try to really minimize the words, you guys, but we can collaborate with other non-diet professionals. That one, again, doctors, nurses, you guys have a role in nutrition, but there's a reason we have nurses, doctors, dietitians, right? You can also partner with other people that are non-diet-centric weight dietitians and health professionals, counselors, all of that. Provide your non-diet training to your staff and other leadership so that you guys know how to talk with patients, because we want to be careful not to use diet culture language with our patients. We can pursue certifications, non-diet approaches. There's a really good new one that just came out that I'm a part of that actually trains health professionals and ministry leaders on how to take non-diet approaches to your health and to having those conversations with patients. It's particularly to help other people in your life. Also, the intuitive eating counselor certification through the original intuitive eating. Like, those are great ways that you can expand your own understanding. You can look into the Ellen Satter model. She has trainings that health professionals can take. You can incorporate screenings for eating disorders and disordered eating into your intake forms. That way we're not missing it. We're not looking at weight bias and saying, oh, that person has a curvier body, so therefore they must not have an eating disorder. That, again, not good practice. But if we ask questions and we get to the root relationship with food, it helps us to be more aware of what's really going on. When patients have concern about weight, we can use non-diet conversation, focus on health-promoting behaviors that are centered around weight loss. So what can we add into our life, or what can we even take out? What, like, in the sense of boundaries, like, I don't know, does that person ultimately struggle with boundaries in their life? Maybe that's why they're overcommitted to things, and that's where maybe counseling comes in. So we can encourage counseling and reevaluating why are our patients overcommitted. I work a lot with expectations with my clients. What are the expectations we have on ourselves and others? It's important. We can prescribe proper diagnostic testing when we're concerned about health, regardless of a patient's weight. We can not blame that person, that their health conditions because of their weight. We have no knowing that that is the cause, but we often do that as health professionals. And we can take our approach of humility as health professionals, and we can always make the assumption that there is something to learn from patients, listening before speaking. Just like that patient case I told you that with my own client. If that doctor was listening to her, that my client knows her body. She knows her body, but she went in and was told something's wrong with her body that was not related to the problem that she was trying to figure out. We need to listen to our patients and let them help us to understand what's going on in their body. Teach our patients that they can trust those cues, that they can trust when you notice something's wrong and you come to me as a health provider, am I trusting what you're saying? And then just to end with a couple scriptures, Jesus declared, I am the bread of life. Whoever comes to me will never go hungry. Whoever believes in me will never be thirsty. And therefore I tell you, do not worry about your life, what you will eat or drink, about your body and what you will wear. Is not life more than food, the body more than clothes? Thank you, guys.
Christian Community Health Fellowship exists to encourage, engage, and equip Christians to live out the gospel through healthcare among the poor and marginalized. If you enjoyed listening to CCHF Talk, make sure you follow, like, and share on Apple Podcasts, Spotify, Deezer, or wherever you find your favorite podcasts. To learn more about Christian Community Health Fellowship, visit cchf.org and follow us on Instagram, Facebook, and YouTube. Join us next time for another episode of CCHF Talk.